Hello, my name is Ashley Lowry. I'm a nursing student at Indiana State University, and the topic of my health education presentation is holistic health assessments and diabetes prevention programs. So, who's at risk? The population at risk are adults in low-income communities who are at risk for developing diabetes. Here are the following learning objectives. At the conclusion of this activity, participants will be able to define a holistic health assessment. At the conclusion of this activity, participants will be able to identify potential health risks related to diabetes. At the conclusion of this activity, participants will be able to name at least 3 ways to help reduce the risk of diabetes. At the conclusion of this activity, participants will be able to evaluate the importance of the diabetes prevention program. I've included a pretest to check your knowledge on the topic. Don't worry, everything will be covered in the presentation and answers will be provided at the end. So what is a holistic health assessment? A holistic health assessment goes more in depth than just your physical health. It looks at the entire condition of the patient. Your stress levels, diet, and poor relationships can all worsen health conditions. The holistic health assessment is supportive and non-judgmental, and it allows healthcare professionals to gain important knowledge and information that can help them diagnose or create a care plan and implement an individualized care plan. The 6 aspects of a holistic health assessment include physiological, psychological, sociological, developmental, spiritual, and cultural. I previously mentioned a plan of care. So, what is a plan of care? It's a personalized outline that's created by a healthcare provider, and it highlights the individual's needs and establishes goals and interventions. If you're unsure what diabetes is, here's a little education for you. So, diabetes is when your body cannot process the food that you eat to use as energy. So, because of this, you have an excess amount of sugar or glucose that is in your blood and it's circulating throughout your entire body, which is why it can have many harmful consequences. Here are some of the health risks that are associated with diabetes. Heart disease, a disease of blood vessels which can lead to high blood pressure or stroke. Nerve damage in your extremities, kidney disease, eye diseases, increased chance of skin infections. Your wounds will heal more slowly and they can become seriously infected that may result in amputation, hearing impairment, sleep apnea, and dementia. There are several things you can do to help prevent diabetes. You can change your diet and eat healthier foods. Get active, but remember, start low and slow. Lose weight and feel great. Stay active. Avoid sitting too long and try to get up every 30 minutes, even if it's just to walk outside or around the house. It's always a good idea to work with a healthcare professional to evaluate your risk and establish a plan of care. So you're probably wondering why low-income communities have a higher risk for developing diabetes. Living in poverty increases the risk of diabetes by 26% and puts people at risk for other diseases. This is why healthcare professionals should pay closer attention to socioeconomic conditions to better help the community by increasing awareness and prevention of diabetes. Most residents of lower income neighborhoods don't have easy access to fresh or healthy foods or education programs that promote physical activity and that teach people how to live a healthy lifestyle. Many households lack the financial resources to maintain a healthy diet. Chronic stress from living in a low income environment can negatively impact health by increasing the level of cortisol in your blood. Higher cortisol levels are associated with higher blood sugar and/or higher blood pressure. So, what are the benefits of a diabetes prevention program? These programs can help build healthy habits and provide education and resources to at-risk communities. Healthcare professionals will first perform a holistic health assessment and do an in-depth review with the individual. Next, you have healthcare professionals, dietitians, counselors, and lifestyle coaches. They can help teach new skills, help boost self-esteem and self-confidence, establish a plan of care, and set goals for the individual. A monthly calendar with activities to help people get out of the house and into their sneakers will be provided. Support group meetings that follow an approved curriculum with lessons, handouts, and other resources. And people can also talk about their goals and challenges or share recipes and tricks to getting healthy. People can establish healthy, long-lasting relationships with other group members, and they can help keep each other in check and plan their own exercise groups or find a walking buddy. In addition, the program will offer reassessments, blood pressure checks, and weigh-ins. Evidence-based practice for a diabetes prevention program includes lifestyle-related strategies, medical management with ongoing evaluations, and behavioral therapy and motivational interviewing to survey the full health continuum of the individual. The U.S. Diabetes Prevention Program conducted a randomized control trial with 3,234 participants. The participants were followed for 2.8 years. They were grouped into a placebo group, metformin group, and lifestyle modification program group. Key findings showed that 58% and 31% had a reduction in the incidence of type 2 diabetes in the lifestyle and the metformin groups compared to the placebo group. And after a 10-year follow-up, the beneficial effects of lifestyle modifications were still significant. Here are the answers to the pretest. Let's see how you did. Number 1. What is a holistic health assessment? Remember that a holistic health assessment is an in-depth assessment that addresses emotional, mental, and spiritual health in addition to your physical health. Number 2. How many aspects are included in a holistic health assessment? The answer is D, 6. There are 6 aspects that are included in a holistic health assessment. Number 3. Is a plan of care permanent? No, a plan of care is not permanent and it can be changed. Number 4. What do carbohydrates turn into after you eat them? Answer is B. Carbohydrates turn into sugar. Number 5. Does diabetes affect your whole body? Yes. Remember all the organ systems that I named earlier? Diabetes affects your whole body because glucose is in your blood and your blood circulates throughout your entire body. Number 6. Diabetes can lead to problems with your D. All of the above. Heart and blood vessels, eyes, skin, and many other organ systems. Number 7. What are some ways to prevent diabetes? All of these answers are ways to prevent diabetes. Get active, eat healthy foods, lose weight, and stay active. Number 8. Living in poverty increases the risk for diabetes. A. True. Number 9. Most low-income neighborhoods don't have easy access to fresh and healthy foods. A. Also true. Number 10. The Diabetes Prevention Program will offer holistic health assessments, blood pressure checks, and weigh-ins. This answer is A, true. Here are some additional resources for diabetes prevention.